Hi, everyone, and welcome to the show. We have a really special show this week because I'm excited to participate for the very first time in the African American Wellness Association's walk, this one in Los Angeles. They have many events across the United States throughout the year. I got involved because Johnson and Johnson, well, actually Janssen, a version of Johnson and Johnson, they have a um, a Save Legs, Change Lives program to help raise awareness for peripheral artery disease, which is those blocked arteries and mainly the leg arteries. And they bring their empowered van out to these walks across the country throughout the year. And they offer free testing. And the Way to My Heart, my nonprofit, got involved in helping those patients who test positive to learn more about PAD, get help from their doctor, get the resources they need, get some copay relief in case they need that, transportation between appointments, whatever they need to facilitate their care, we're here for them. And I'm excited to bring in the director of the LA Walk. We have Jhade Barnes, who's here with us, and he's going to be sharing how he got involved in this association, why he's passionate about it, and what we can expect from this event and others as we bring in 2024. But first, a big hello to my co-host, Dr. John Phillips.
Hello, Kim.
Oh, and I love your Save My Piggies mug that you have there.
Right.
Very
That's right.
festive.
Yeah.
Right on.
All right. Yeah. No, it's really ironic today that we're having this conversation because as I shared with you before we went on air, I had two representatives from Janssen in my office this morning asking me how they can help us with, among other things, patient advocacy, raising awareness, and kind of divorcing themselves a little bit from, hey, we're pushing pharmaceuticals to how can I help you and your patients get access to X, Y, and Z. And I do know that, as you had mentioned, Janssen, they do sponsor some of the screening and stuff for this walk. So it's kind of ironic actually that we're having this conversation.
Yeah, I've loved their team, and what's amazing is I've worked with Jillian Stevens and Richard Brown. He's their lead cardiologist, and quite a few others, Sean Middlestat, within the organization. And at their core, they're truly, truly passionate about saving legs and changing lives. It's not just a campaign; it's truly a culture for this organization, and I feel like I'm blessed to actually be aligned with their campaign
Yeah, I mean,
and know
sometimes,
that they're
right? I mean,
concerned.
pharma gets a bad rap a lot of times.
Yeah,
Their drugs are expensive, and I told that to them today. I said it's nice to have a conversation about y'all wanting to help us out as opposed to jacking up the prices of drugs, and that's a whole different story. But I truly, to your point, I think that they want to help, they cross the boundary of, yeah, we provide a medication that might help folks with peripheral arterial disease and coronary artery disease to, hey, let's try to touch people that are in at-risk populations. And in fact, I think they are working on a heat map for
oh, yes.
African Americans in particular and
Yep.
amputation rates. I mean, it's pretty staggering when you see this, even in like our own backyard, the the dis, the disparate nature between how non-African Americans and African Americans and the amputation rates is pretty, it's embarrassing, frankly, and staggering.
Oh, it is incredibly embarrassing. And I got to play with their heat map in Las Vegas just last week at one of the vascular conferences at Viva. And it is truly magnificent. The investment of time and finances to put that together, you can go clear down to the neighborhoods and see which neighborhoods are actually at highest risk of amputation and that are getting the most amputations. So, I mean, I think it's going to do a lot of good. I mean, I just wanted to sit there the entire conference and just write down and take notes on these different neighborhoods so that we can show up there and let everyone know that there are options available. And I have a little announcement to make just today. As the Way to My Heart is restructuring, one of our patients that we featured recently, Charles Winters, has agreed to be chairman of our diversity and equity and inclusion PAD Warrior Task Force. And because he's been played an integral role in helping us to word our brochures so that they can reach different cultures and different communities and really speak to them and have an impact. So I'm really excited about that
Yeah,
as
that's
well.
awesome. That's
Nice.
awesome. I know there's a lot of restructuring going on, so it's
Get
good. It's
ready to
good
get your
work.
hands dirty and work
Yes,
really, really hard.
that's right. That's right. My hands were pretty dirty today, so I was in the cath lab all day. So I'll share a little insight into that once if Master Mike gets me a moment of inspiration.
Dr. John Phillips' spectacular vascular moment of inspiration.
Well, so okay, perfect. The clap seems to be new. That's awesome. All right. I was toying between two quotes today, and it. So I had my first case this morning was a little bit. I knew it was going to be complicated, and I was perseverating it over it last night, and like most things, there's this kind of theory of analysis or paralysis by analysis, and I think I wasn't paralyzed because the case went really well. But so I found this quote from Dale Carnegie, and it's pretty simple, but he's quoted as saying, "Remember, today is the tomorrow you worried about yesterday." I'll let you
Okay,
stew
that's
with that
really
one.
profound.
Okay, so
Today is tomorrow.
yeah, today is the tomorrow you worried about yesterday. So for
Okay.
me, let me put it in context. Yesterday, I was worrying about tomorrow, which was today, and the case I had to do. And then today came and it happened, and we got the case done, and we're moving on. So I think what he's trying to say is, maybe we worry a little bit too much, and things usually work out, and just kind of let let things evolve as the day evolves. Now, I have another quote too, real quick, because I like this from Einstein, and it's similar. Learn from yesterday, live for today, hope for tomorrow. The important thing is to not stop questioning. And
I
that's
think
it.
that's really important as well.
That's a good one too, because we're always questioning, and we're going to start questioning
Sure.
Jake pretty soon here.
No, but get ready for the firing squad. But it's really about asking the right questions, and that's how I, as a journalist, and I ended up winning my Emmy Award for my line of questioning because I always believe if you ask the right question, you get the right answer. And in advocating for patients, I carry that along because I think that my superpower is in asking the right questions. And I train the patients. I train people with PAD or peripheral artery disease, how to ask the right questions to get the right answers to make more informed decisions on their care. It really empowers them, to also become a better partner in their care along the way.
Agreed 100%. And I think we should all do more question asking, more listening, and less talking. So that's a great segue to
To Jhade Barnes, welcome.
Thank you. Very
I know
happy
I've
to
been
be
watching
here.
you. You're just dying to jump in there. What did you think of those quotes? Do they resonate?
Oh, I love it. You can't always worry about what's going to happen. You just got to go forth and do it. I believe in moving quickly, failing quickly. That way you can make the adjustments that are needed. I think forward motion and progress are the biggest things and most important in terms of advancing everything, every aspect of your life. So that locked in real well. And even with the journalism conversation, I believe that if you talk long enough with someone, the truth always comes out. So just keep asking and you'll get to the core and the devil in the details.
I love that. My coach always said, you need if everything always works out, then how would I feel about this situation? If everything always works out, then how would I differently or react to this situation, right? And it's just asking that question is even one of the most important questions that you can have, in life to keep you moving forward, right?
and along those same lines, as Jade, you had mentioned, if you ask enough questions, you'll get the right answer or to the truth. That's what I tell our residents when we're training them and medical students. Sit down, talk to the patient, ask questions, listen to the patient. They'll tell you what's wrong with them. I mean, we can order
Yeah.
tests and labs and things, but at the end of the day, if you understand medicine and you listen to the patient, they'll tell you what's wrong with them, and then that unlocks the key to treating them successfully.
Completely agree. Well, coming up right here on the Heart of Innovation, we're going to get to the heart of Jhade Barnes' big event along the lines of the African American Wellness Association, a big walk this week, and many more to come in 2024. So stay with us for all the details.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Hi, everyone, and welcome back to the show. Today, we are talking about the African American Wellness Association and their big walks that they have across the country. Their final one of the year is happening in LA this week, and the director of that walk we have with us, Jhade Barnes. Jhade, welcome. Thank you so much for joining us.
My pleasure. Very happy to be here.
So I want you to, get to the heart of what is the African American Wellness Association and how did it start? I know that you aren't the founder, but what is it? And then how do you got involved?
Sure thing. So the African American Male Wellness Agency was headquartered and founded in 2004 by John and Pam Gregory. It was really a response as to research project that we did around Black men going to work. And what we uncovered was that health and wellness was one of the alarming things that came up when it came to employment and sustainability and self-sufficiency. So we implemented doing wellness checks in order to be funded in terms of getting your check each week for work participation. And with that, we uncovered that Black men were dying 12 years earlier than their white counterparts. And as a response to that, created this awareness campaign, which now resides in the 5K Walk and Run. The 5K Walk and Run is really the push to kind of bait and carrot that leads people there. But our core goal is to provide free health screenings to our communities where you can get your core biometric screen, your height, weight, blood pressure, your glucose, HIV, STD. And now as a signature part, we have the pad, empowered pad that comes out and makes sure that we have those aspects for screening as well. So really, really fantastic cause. I've been out in LA for the last 9 years, and a buddy of mine called me up and said, "Hey, Jhade, we're looking to be in the LA market. Would you be the guy to help us spearhead this and really get it up and running and duplicate what we're doing in 16 other cities?" So I was like, absolutely. This is a time to get involved. Health matters. I'm getting older. There's aches, creaks, pains, and stuff that now I need to actually talk to somebody about. It's not lay down, get some, ginger ale or some crackers. It's like we may need to go talk to somebody, do some blood work, and really figure out what's going on. So with that, I've really been tasked with reaching out to several different community partners that can also be there in attendance to the event. We'll have about 72 different community partners this year, where they're providing free information, resources that really can help the overall health and wellness for the entire Black community. So men, women, children, you name it, come out. There's resources for you. And we continue to add on additional partners that can help us increase the life expectancy for Black people.
Jhade,
Go ahead.
Thanks. So I'm going to ask you, just in your opinion, what do you think it is that has created, like historically, this chasm between African American males and their white counterparts or non-African American males with respect to health? I don't know if it's inequity or just lack of health care, or what do you, I mean, like, do you guys have any idea, like, what you think the heart of that comes, or where that comes from?
Indeed. So it's all of that, and it's multifaceted. So I don't know that there's a simple answer, but there's a variety of things that, come up. Naturally, as a man from birth, we're usually taught to kind of shake it off, kind of work through it, and ignore a lot of the aches and pains that we have, when it's very, very feasible to go to, a doctor and get some health care. The other part is the economic aspect in terms of being able to afford health care and the availability or access to care within the communities that you live in. So when we think about, and the representation that are there, I believe the last data I looked at, it was around like 86% are non-Black physicians that are in our communities. So when you go there, you don't necessarily have representation that looks like you, understands kind of like your family background, or even can communicate the technical terms or the medical terms so it makes sense to you. I look at things like my chart and the documents and reports that come out. And I went to college, I read fairly well, but it's confusing if you don't understand the jargon. So I think that's one component. The other one that I think goes unmentioned kind of too often is the historical context around distrust within the medical field. With the Tuskegee experiment and other issues where we thought we were in the good faith and had trust where these things were going to help us, it turned out to be the exact opposite. So with that happening, I'll just kind of figure it out, or there's grandma's home remedies that we're working through, which may or may not all be bad, but being able to really connect and have a level of trust and relationship with our primary care provider, if we have a primary care provider, is certainly important. So communication, trust, access and availability, representation, education around the need to even get screened. One of the things that I found working on this, Dr. Phillips, is that, as men, we'll know when we got the last tire rotation. We'll know the last time we got an oil change. We know when the last time we had a car wash, but we have no clue what's going on inside of our bodies, what our blood pressure looks like, what our glucose, what our sugar levels are. When we think about those are all, leading indicators as to something that could happen down the line. And most of them are preventable. The data around the 12 years dying earlier than our white counterparts are all around preventable diseases and illnesses. We're not talking about just in general. We're talking about stuff that if we know our numbers and have the education and access to resources are 100% preventable and treatable and manageable. So it's important with this campaign that we focus on those and normalizing going to the doctor, taking mental health, physical wellness, all of those things very, very seriously and intentional about ourselves.
And it's really interesting because there's so many genetic factors. We have legendary Harlem Globetrotter, Shorty Coleman, who's involved with us, and I know he's on the line and listening. I'm not sure if he wants to jump in here, but in my conversations with him, I mean, he's an athlete. He's been a professional athlete for years and years and years, and genetics caught up to him. His mom ended up with diabetes and amputation, and so next in line is Larry. He ends up with an amputation, and it's almost like, well, you know what? I almost expect it. So you just don't push back against doctors. And you're like, well, there's nothing I can do anyway. So just let nature take its course. Do you find that to be an issue and the mentality?
Yes, indeed. So we just kind of go with the flow and just kind of, it happens. My granny had it, my dad had it, then I'm just going to get it. And that's not the case. With awareness, education, and access to people who go to school for a very long time, the doctor can attest, like there's a lot of education and research and work that happens, residency where they are trained to be of assistance. And there is an intrinsic value and purpose within helping people and saving lives. And we've just got to work together and partner to overcome those disbeliefs that we have.
I want to ask you, oh, sorry. I was curious about how do you develop trust? Because, I thought you were going to say trust is an issue because that historically, I think, is what I think of when I hear about African Americans and their sometimes hesitancy to seek medical attention until it's, the kind of train has come off the tracks. So how do we foster trust? I know this is something like this obviously is raising awareness, but I'm curious as a white physician who, frankly, I see very few African Americans as to where I'm at. Mm-hmm. But I have a great trust with my patients, I think. But I don't know. I mean, I wonder sometimes, do they think there's something nefarious going on? So my question is, like, how do you start to develop that trust? Is it truly a grassroots effort, like something like this, or is it bigger than that?
I think I think there's a two-pronged approach. So one, certainly these type of events help build that trust. We're a grassroots organization. We're knocking on doors, we're in the streets, we're having conversations with real people in real time, and we look alike. So that gives us an edge. Our goal, really, in strategy has been to partner with physicians and organizations to, one, make sure we're in alignment in terms of what that looks like, how care is administered, whether these social factors and communication are in place where you can actually help our community. And with that, we serve as that liaison that, as an agency, we vet and screen and integrate with these primary care providers, insurance, physicians, in order to say, hey, this is a good group of folks. Let them help you. Let's work through that. The other part, the second part to this, is a much longer play, and in which that we have to get more Black folks in the medical profession in general. So representation is there. Then internally, there's some communication that can happen about best practices in communicating, what to look for, some kind of social norms that can establish that. But time is really going to be the only thing that really helps us break down that barrier of trust.
And coming up right here on the Heart of Innovation, we're going to talk more with Jhade Barnes with the Wellness Walk in LA. He's going to give us some more details, so stay with us.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Hi, everyone, and welcome back to the Heart of Innovation. We are talking with Jhade Barnes, and we also have legendary Harlem Globetrotter Larry Shorty Coleman, who's been listening in. Larry, before the break, I had mentioned our conversation that you and I had about your experience and the frustration of being an athlete, a professional athlete yourself, and then genetics still catching you. Would you mind sharing your feelings, your insight on the conversation?
Yes, I'm glad to be an African American or any other race, but when it starts to affect us health-wise, we need professional people. They need encouraging people like myself and Kim and other doctors. We'll knock this out the box. It's not something we just gonna put a Band-Aid on. And my situation, my mom had diabetes. I didn't pay it no mind. Is this going to run in the family? Yes, it did run in the family. So did PAD. But I wasn't educated on it. And I just took for granted, being an athlete, that I could overcome this. Boy, did I fool myself for 62 years after 11 years of playing basketball. And I said, the professional, the money don't make a difference. Just having great health and not looking down and not see that other limb. That's the ultimate goal, and I found a way to be happy with the situation.
Do you find, Larry, and I'm curious also from Jhade's perspective, any misconceptions that are out there? Because I had a conversation with Charles Winters, who's a fellow PAD warrior, and he's going to be heading up our diversity, equity, and inclusion patient task force. And I had him look at this one brochure that I created, the one that has also your picture on it, Larry. And because I got feedback from another advocate and another clinician that it's too wordy, I need to speak to a 5th grade educated person, it's too much for people. And he said, absolutely not. He is tired of people underestimating the intelligence of the African American community. What is your point of view on the educational resources out there?
Well, I'm going to tell you from what I was told and how I was treated, some way they take for granted that we're not capable of getting an education or we're not smart enough. Anyone that God put on earth is smart enough to be anything they want to be, just by believing. But from being African American, I felt disrespected in the hospital to hear a guy see me in emergency and say, man, we got to get you ready for surgery. We're going to do amputation. I thought he was talking about an antenna. I was so nervous, but that never happened that way. And he almost was like slapping me in the face, like, well, he only have Medicare, and Medicaid. We'll drain that and move on to the next person that's interests of African American, or they don't care now, white, black, yellow, or blue. And I'm so glad that you're on the line, other doctors. Something has to be done, man. If not, we'll be all walking around playing pogo stick.
Yep. And Jhade, what are your thoughts in hearing what Larry has to say about his experience? Is this something that you hear a lot?
I definitely hear that. There's always a fear of the financial component around, what you can pay for, and a fear of if I only have this level of insurance or level of coverage, then I'm going to get, marginal care. And that is a great concern when you think about health equity. And I think, trying to make sure that people understand that there's programs and resources out there to help offset those costs, as well as support systems really help guide. When it comes to like printed material and marketing, I do think that everything when it comes out in the medical field or from the medical field should be almost at a third grade level. That way, anybody who picks it up has a very, very high likelihood of understanding what's happening to them, what the options are, the pros, the cons, and are able to weigh those out. But there's also this third component where the physician really has the opportunity to educate the patient around the procedures, what's going on, what those options are, and really becoming a partner when it comes to making medical and health decisions for that individual.
Yeah, I'll
Is
just
it about bringing it down though to a third grade level, or is it about just simply putting it in layman's terms versus medical terms?
Well, let me just say this: we have to. When we create like a consent form, it is written in for a fifth grade reading level, and I think that's done for a number of reasons. Number one, you don't know where the patient is on the spectrum of their health education, their knowledge of what's going on, and so if we throw in a bunch of big terms, that just leads to confusion. However, as Jhade was saying, it's my job to, yes, we write it in a fifth grade reading level, but we can talk and speak the medical jargon to some degree, but you also have to be like a good physician can translate what I know needs to happen through my training to explaining it to a patient who has no idea. And I liken it to, I don't know anything about cars, but I got a mechanic that I trust. If he tells me there's something wrong with the catalytic converter, I take him at face value. I have no idea what he's talking about. I just trust him. And that's what I try to instill with my patients. And I've said this a lot before too. It's like shared decision making is huge. And also I try to be the coach and I want the patient to be the quarterback. I want to give the patient a playbook with some options and I want them to kind of help execute the plays. And any physician who's worth his or her salt can explain to a patient in layman's terms, layperson's terms, what's going on and what needs to happen. Because I think, yes, a lot of it is within the African American community, but it's in the Appalachia of southeastern Ohio too. I mean, the medical literacy is very low in most areas in this country. I mean, let's be honest.
Yep. And Doctor, I think that's a valid point. It's not just the African American community that needs it in layman's terms. I think everyone does. And not only English is hard, just in general. When you look and study other languages, English itself is very, very confusing and doesn't take logical progression in many instances. So just being able to understand and digest the material is important, not necessarily what grade level it is, because we don't want that to be insulting or deterring for people. We just want them to make informed decisions and be able to rely on having a good coach and a physician, and then being able to quarterback your life and how you make healthcare decisions about yourself and for your family.
And I know, Larry, you were trying to chime in and I cut you off a little bit earlier. Yeah. Did you want to jump in?
Yes. By the way, it affected almost 5 family members of mine. The youngest one being 42. He had both lower limbs. And he was so inspiring to me to say, "Oh, you're going to have hard time getting used to this, but I know the fighter you are. And I said, well, you can believe that. And also, my uncle that's 79, he lost his. He's in North Carolina. My brother that's in Virginia, he lost his piggies, as we call it. And I told him, get ready for the roller coaster ride. There's something else coming, sir. And I'm no genius or a genie. Believe it or not, 6 months later, had to cut half his foot. Now he's having problems with both legs. Anyway, is there anything I can pass on to my younger generation of how to overcome this?
Well, I mean, I think what Jhade's doing is that first step. Well, I guess pun intended. We have to raise awareness. We have to screen people. When I see somebody, the horse is out of the barn. When they have PAD, critical limb ischemia, and Kim, we've talked about this, that diagnosis is worse than most cancers, frankly. And it is like a cancer. We need to screen people early. We need to find susceptible populations and mitigate their risk of developing peripheral arterial disease, coronary artery disease, cerebral vascular disease. And it starts with screening for diabetes, monitoring blood pressure, looking at cholesterol and exercise and changing your diet.
And we'll have more with Jhade Barnes and, of course, Larry Shorty Coleman coming up next right here on The Heart of Innovation. So stay with us.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Hi, everyone, and welcome back to the show. We have Jhade Barnes here. He has a very special event happening this week down in Los Angeles, but it's like similar events across the nation, and they've been happening all year long, really focusing on African-American men's health and getting men the testing that they need to help improve their prognosis. Jhade, thank you again for joining us. Would you mind walking us through how the men walk through the different testing stations at your event?
Yes, it would be my pleasure. So Saturday when you arrive, you're going to get greeted by a red carpet. We are in LA, so we do it Hollywood style. You'll have a beautiful red carpet to come in. You'll stop in really, really quickly to meet our volunteers that'll help you get registered. And what that is just put your name and your basic contact information on a quick form. From there, you'll be ushered over to our initial screening stations. We'll do a quick fingerprint to do our core biometrics, and you'll be able to work your way down the line in order to get all of your free screenings and resources, talking with nurses. And then once that's done, it shouldn't take more than 5 minutes or so, you'll be able to speak directly with a physician. We have several organizations, so the Association of Black Women Physicians will be there to then look at the numbers of your biometric numbers and tell you what's going on, what the next step should be. Most of the time, it's just something simple. Hey, we need to watch our sodium intake and watch our blood pressure, or we need to change our diet somewhat, increase exercise. And if need be, we do have physicians and community partners there that can help you with these resources. And that's how Kim and I got together. And many of our partners and sponsors will be there to read through that information with you and advise you as to next steps and what to do. In addition to that, we've brought on a partner called PearSuite, which helps us with our wraparound services and really get connected with a community health worker that can then talk about some of your key social indicators. If you need other resources that may be available on site, we can immediately get you in front of those resources so you can take advantage of it. If not, we may also say, hey, we need to follow with a primary care provider. And if you don't have one, we have the ability to get you connected with one the day of. If you don't have insurance, we can also get you taken care of the day of. We'll have Covered California there. It's open enrollment. We have the Chief Medical Officer, Monica Sony, who will be there and doing 2 rounds of presentations about open enrollment, healthcare, all these types of things. And she's a Black woman, very, very talented, very, very smart, and be able to talk to you. So it's a familiar face, that can advise you as to next steps to improve your life expectancy, and live a healthier, more fulfilled life for you and your family. So we try to create a dynamic event. When you arrive, there will be music bumping, there's entertainment, there's bounce houses for kids. Think about it like going to a family reunion, but we're going to get you a quick checkup before you have too much fun.
I see that you've got a football player at LA Ram that
Yes.
comes up. Is that right?
So in every city, we enlist the help of celebrities and professional athletes to be what we call the honorary chair. And the honorary chair has agreed to be an ambassador, a spokesperson, to use their image, name, and likeness to spread the word about health awareness for Black men and this cause. He's been extremely philanthropic in his own works and has partnered with us to really evangelize what we're doing here in LA and be supportive. So it's always nice to have an NFL player who backs you, who believes in what you're doing, and really believes in the overall increasing the life expectancy for Black people as a whole to just become very normal to get checked up and be good.
I love that you've timed it perfectly with open enrollment and covering California being there, because that's one of the biggest obstacles that we have when we're helping patients across the country is so many people don't have the proper insurance to be able to get the care, and so they end up in the emergency room. And that's where we say, you know what, it is the amputation lottery. Once you get there, whomever is on call is whatever option they have for you, whether it's to open your arteries or simply their solution would be to cut the leg off.
Mm-hmm.
And that's really scary. So it's really good that the patients can actually go there and get insurance. So if they have a problem, they can get insurance that day at your event. I think that's brilliant.
We try to leave no stone unturned. Like, we've done the heavy lifting for you. All you have to do is show up. Bring somebody, bring anybody. It doesn't matter. It's open to the public. We'd love you to register before it, but you do not have to. Just show up. We're there for you.
Resistance
I'm
you
sorry?
faced from the African American community? Have you faced any sort of resistance from some folks in the African American community just showing up and getting tested?
A little bit. We find the resistance actually comes when they're there, but we have a foolproof plan around that. So men will say, "Hey, I just went to the doctor last week," or "I went last month." We don't care. My wife has. I've really enlisted my wife to get some help, but she has brought all her beautiful lady friends out. All the church aunties will be out there. Those are the volunteers. Those will be the people who are ushering you from registration over to the screening group. It is incredibly challenging to tell pretty women and church folks no. So we are gonna help you get over there. Like I said, the screening is non-invasive. It is really, really easy. You'll have, maybe a minute or two, a little finger prick. It is extremely, extremely easy to do. And once you get that knocked out, you get a beautiful t-shirt that we have that says, "Hey, you got your stuff done," with the Wellness Walk branding. We have partners who have donated beautiful tote bags, and we'll have towels, and the t-shirts just came to my door earlier today, like right before we started. So listen, think about just having a good time, being with friends and family. We're going to listen to some good music. We'll do some line dancing. You'll get a quick checkup, and then every resource that you need, from mental health, the financial wellness, the home buying, to foot screenings, and our PAD unit is there, vaccinations, and community organizations that just help with mentorship or fatherhood or growth. They're going to be there. We've got the list. They're signed up. They're excited. They're pumped. If you check our social media at AA Wellness Walk LA on Instagram, you'll see all of our community partners. You'll see the information that's going out. And it's really, really important. We're all committed to it. There's seldomly a person I see as we tell what we're doing that are reluctant, but it's that day of the jitters. I don't know what it is, but like, hey, it's quick. A quick fingerprint, very, very thin vial of blood. You'll get a beautiful Band-Aid, and it's done. Then we can just kind of walk down the list. We'll talk about these numbers and really figure out and make sure that you're in a great place to live long.
So Jhade, how many people, you said this is in 17 cities, just estimate how many folks you think you've touched, number one, and number two, there has to be some people that have come back and said, "Hey, you guys saved my life. Like I didn't know I was this bad."
Every year this happens. So I guesstimate probably about 100,000 Black men have been screened across the country since we started this. And every year there's somebody say, "Hey, you guys saved my life, because if I didn't know that my blood pressure was off the charts, like I could have had a heart attack. You were about to run a 5K and your blood pressure's through the roof. Like, it's a terrible idea." And in each city, we find we have to call a bus for someone, unfortunately, but we're able to prevent it. And we find fathers and sons come out, which is fantastic. And it's just like, you saved my dad's life. You know, his cholesterol's up, his arteries are going crazy, and we never knew. And if he didn't show up today, he could have died. And that's what really makes the difference. That's why we say we're saving Black men's lives. We're giving people the opportunity to figure out those numbers, take preventative steps. By the time it gets to the good doc, it's too late. And we don't want you to be too late when we can clearly do this for free for you, this Saturday, and in cities across the country. We're here to help. And once we do this, we want to normalize going to a primary care provider at least once a year. And if you have other things that are going on, things that we find out with these numbers, then you may need to speak to a specialist periodically throughout. But it's very, very important to take those proactive steps. That way, if you know better, you can do better. And we're here to educate and support and advise and love on you as much as we can.
Jhade,
do you ever right here on the Heart of Innovation, we're going to have our final thoughts, so stay with us.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Welcome back, everybody. We are coming up to the top of the hour. We only have a few more minutes left with Jhade. So, Jhade, as we end the show, where do our listeners get more information, not only about the walk in LA, but walks across the country? Is there a website they can go to find out if there's a city close to them that they can participate in?
Indeed. I want everyone to take a moment to go to aawellness.org. That's going to give you our parent company, or really our overarching company, with all of our initiatives, our programming, from the fatherhood to the financial wellness to our health and wellness and mental wellness with Real Men, Real Talk. You'll be able to get all of that information. And also, it's aggregated by city. So it'll pick a city next to you, one of the 16. Hopefully, we're close to you, and you'll be able to engage and see the upcoming events and programming that we have going on. So again, that's aawellness.org. And that'll give you all the information. You'll be able to find me, my contacts right on there when you click LA. If you have questions or needs, I'm your guy. I can help out, and very, very very happy to support it.
So beyond this particular event, this is the final one of the year. What do you expect to unfold in 2024? If you could have every wish come true in 2024, how do you see these events evolving?
Yes, growth is the number one thing. So 2024 will be dynamic. I know there's some things that I can't release yet because we haven't made public, but we've got some major superstars that are coming on board around our mental health partnerships. Every year that we do this, we grow more and more corporate sponsorships and partners that help us carry out our mission to increase the life expectancy for Black people. So I'm very optimistic for 2024. Larger events, larger resources, increased velocity, more consistency with our programming, because we have such great support from our sponsors and community partners. So bigger and better. And if you want us to be in a city near you, reach out to us. It is a little work, but as long as you're willing to put in some effort, we can spin it up and come to your city depending on the area.
That's a really important point, because if anyone wants to hold an event like this in their area, there is the opportunity to do this through this organization. You have proven events, and all they have to do is literally replicate it in another city. Easier said than done, but it is possible. And you have the support, right?
Absolutely. We're here for you.
Jhade, you gonna come to Columbus next year?
Oh yeah, I missed it this year. I don't know what I was doing this year where I couldn't make it out, but I've been there. I lived in Columbus for 12 years and spent many a day out there. I was one of the vendors, many of those walks, and then I just left Columbus what was it, last week? So I'll be back in December, and we'll have a national coordinators meeting with every city and every planner, just like myself. And we're planning for 2024, what that looks like, all the bells and whistles. I can let you know that the name is going to change. So it'll be the African American Wellness Day, where we can be all inclusive of men, women, and children. Although we do that, actually now we're going to be very intentional about making it be more inclusive with the name and title itself. So I can't release that now.
I love that. And I think that if you do, just as an incentive to go back to Columbus, I think that maybe Dr. John over there might invite you into his cath lab to watch a couple procedures.
If you want to, I'll be there. You let me know when that one is in Columbus, I'll be there.
All right. Don't tempt me with a good time.
All right.
Thank you for all you do, Jhade. Have a great weekend, everyone.
Thanks so much. Take care.
Take care.
The Heart of Innovation is for educational and informational purposes only, and advice and views shared are not a substitute for medical advice from your own supervising physician. Do not act on any information provided in this show without the explicit consent from your own healthcare team. If you think you are having a medical emergency, call your local emergency number or go to the nearest hospital or emergency room.